Hello, I'm Dr. Hoin-sik. Today I'm going to talk about aesthetic prosthesis using zirconia crown. This is the contents for today. Aesthetic prosthesis based on ceramic, zirconia prosthesis, digital dentistry changes everything, ceramic prosthesis versus zirconia prosthesis, and how. If you listen in on aesthetic prosthesis lecture, what's those lectures mostly about? They mostly talk about anterior prosthesis. When we talk about aesthetic prosthesis, we rarely hear people talk about posterior prosthesis. And a lot of aesthetic prosthesis is based on porcelain, and that is mainly taught in lectures. In the early days of aesthetic prosthesis, porcelain fused to metal was used. PFM prosthesis was used. The problem with this prosthesis, what are they? As shown, porcelain chipping could occur, or the metal part can be exposed in the margin, resulting in unaesthetic outcomes. These days, people rarely use metal in aesthetic anterior area. However, even if we don't use metal, porcelain chipping continues to occur. In the posterior area, to make it more aesthetic, for a long time, people used porcelain fused to metal prosthesis. However, in the posterior area, even more so than the anterior area, porcelain fracture occurred. Koreans like tough food. Porcelain chipping and fracture is a tough problem for us. In order to rectify this, a lot of attempts were made to make prosthesis without chipping. The best way up until now was full zirconia crown. The problem with full zirconia is that it is very unaesthetic and it does not blend in with adjacent teeth. Aesthetics were an issue, especially in implant prosthesis. As shown, unlike adjacent teeth, it is very white and opaque. I'm sure everyone has had experience. This is my patient. In two premolars, implant was placed and crown was done, and full zirconia crown was provided for molar. Whenever the patient returned, the patient's complaint was that it was unaesthetic. The patient complained it's too white and dark. My friend's implant is made of porcelain and it's very pretty. Why is mine so gray and opaque? The biggest issue with the zirconia crown is white, opaque, and it's gray. This was the biggest problem. Is it an innate problem of zirconia prosthesis? Up until now, we had a divide and conquer system where treatment was done by the dentist and prosthesis fabrication was done by lab technician. However, digital dentistry changed everything. From now, I'm going to talk about an aesthetic prosthesis based on zirconia. Molar area, I provided full zirconia crown. Unlike the crown we've seen up until now, you can see that it's very aesthetic. Lower canine. Full zirconia crown was done and very aesthetic result was achieved and it has similar color to adjacent teeth. Third, existing gold crown was removed. You can see a lot of tooth discoloration here. With full zirconia crown, the aesthetic problem was resolved. This is anterior bridge case. Central incisor was extracted and prepped. As shown, full zirconia prosthesis was provided. This is a failed bridge. After I removed the bridge, it was like this. In number 36, I planned for an implant. And for number 35 and 37, crown was fabricated as shown. It is a full zirconia crown, but it is very aesthetic in terms of form and color. On the left is the crown which was delivered in the past. On the right is a zirconia crown that I made within my dental clinic. There is one common factor in what I've discussed up until now. What is that? First, I made full zirconia prosthesis. Second, I did not use model and used a digital workflow to fabricate zirconia crown. Third, within the dental clinic, I made the crown. Fourth, there is no limitation in terms of indication for zirconia crown. Anterior premolar, molar area, you can use full zirconia to do treatment. How was this possible? How was I able to use zirconia crown like this? Before I talk about the overall fabrication process of zirconia crown, I'm going to talk about comparison between ceramic prosthesis and zirconia prosthesis. A lot of people ask this question. Is ceramic more aesthetic than zirconia? In order to provide ceramic prosthesis, you need 4-axis milling machine. Emax or Impress or other ceramic materials are used to mill crown or inlay. If zirconia crown is as unaesthetic as shown, ceramic is aesthetically better than zirconia. However, if you can make zirconia like this, the aesthetic value of zirconia crown does not fall behind ceramic. There is limitation in applying ceramic crown, that is the strength. In the case of Emax ceramic, which is used frequently for aesthetic crown, it is highly transparent and it is used frequently. However, the strength is approximately 530 megapascal and is about half a full zirconia crown. Therefore, there is possibility of fracture if you apply it in the molar area for crown of implant or natural tooth. In the case of Empress crown, the strength is only 185 megapascal, and therefore you cannot use it unless it is the anterior area. When we make Emax crown clinically, you mill and do polishing. In general, through crystallization process, you set the crown within patient mouth. However, if the patient's tooth color is very distinctive, you cannot reflect such characteristics with only crystallization, and therefore additional staining is required to reflect such traits. Apply glazer and on top of it do staining. do crystallization once again. After that, you set on the patient mouth. In the case of Empress, after you mill without additional crystallization process, you finish the crown with polishing. However, even with Empress, even if the patient's tooth color is distinctive, you need to do glazing and staining and do separate firing process to provide crown for aesthetic result. What I want to say is that although ceramic is a very aesthetic material, if the patient's tooth color is very distinctive, additional firing and staining process is required. Second, a lot of people ask me about multi-shade zirconia. Using it, they ask, will it assure an aesthetic result? Actually, no. This is my case. In upper central incisor, an aesthetic result came to be. Crown was removed. Prep was done once again. As shown, crown was completed. What's the problem? Compared with adjacent teeth, there's a lot of difference in terms of transparency. In regards to patient's teeth, in the case where transparency is very severe, additional staining needs to occur. With only multi-shade zirconia, you cannot really reflect such distinctive traits. This high school student rode motorcycle. Central incisor was fractured. As shown, multi-shade wool zirconia was used for the crown. As shown, additional staining was required to reflect the transparency on the incisal surface as well as the lateral side. That was the case. With only multi-shade zirconia, there is limitation in expressing the transparency of patient's tooth. This is very important. If you have to choose between ceramic and zirconia crown for your dental clinic, which do you need to choose? If you have sufficient space and is financially capable, you can have both systems. However, if there's limitation in terms of space and finance, and if you need to choose between the two, I believe it is more efficient to have material and equipment with a bigger spectrum. If I were to evaluate thoroughly, considering the scope of the material and the strength, aesthetics, and the cost that is required to establish a system, I would choose zirconia crown over ceramic. That would be more reasonable. That's my personal opinion. In order to make aesthetic zirconia crown, what do we need to do? I like to touch upon this point. In order to provide aesthetic zirconia crown as shown, first you need to have initial photo. Based on initial photo on the dental system, you design the crown similar to pre-op tooth. And after that, you do coloring to give it color and do firing. And finally, you provide staining to give it that distinctive trait. For initial photo, you take it from the occlusal view and 45-degree lateral view, as well as lateral bite view, so that the patient's tooth form, transparency, and shade can be taken into account. It can be compared with a pre-op photo. With a pre-op photo, you make it similar to the pre-op tooth using the dental system. Design, milling, coloring, sintering is done. In this patient, I only did polishing. After treatment, Using the same format, occlusal view, 45-degree lateral view, and lateral bite view is taken. I compare it with the final prosthesis with the initial photo, and I provide continuous feedback to the patient. This is a different case. This is occlusal view, 45-degree lateral view, and bite view. Based on the initial photo, you come up with the basic form and shade of the tooth to be designed. Using dental system, design was done, milling was done, coloring was done, centering is performed. After that, in this patient, there were distinctive traits in the tooth color. Additional staining was added. This is final prosthesis, occlusal view, 45-degree lateral view, and bite view. The groove form and discoloration in the groove. In order to recreate the initial photo, a lot of effort was put in, and you can see that here. Conclusion. Why zirconia crown? I'm going to summarize about aesthetic zirconia crown for prosthesis. In the past, we used a lab to get the prosthesis the analog way. There was no chipping. However, it was quite unaesthetic, and that kind of occurred very frequently. Full zirconia indication was for premolar and molar and was limited. However, what has changed today? We fabricate prosthesis within the dental clinic. We fabricate prosthesis using digital workflow that does not use model. Chipping occurs less, however, you get a very aesthetic result with zirconia crown. Finally, you can not only use zirconia crown on premolar and molar, but on the anterior area as well. The material and the equipment have improved significantly. Finally, in order to get aesthetic zirconia prosthesis, these are the things that you need to prepare. You need to take initial photo. Based on it, you need to use appropriate CAD program for design. Provide basic color using coloring. In the case of tooth with distinctive traits, staining needs to be done. These need to be met in order to get aesthetic zirconia prosthesis. This is the end of my lecture. I'm going to now have Q&A session to address your questions. First, the question. If you want to get aesthetic zirconia prosthesis through lab, what kind of things do you need to prepare? Same with the prosthesis fabricated within dental clinic. In order to do it through the lab, you need a photo. Pre-op photo, occlusal view, lateral view, and the bite photo needs to be sent to the lab. Even with those photos, if an aesthetic zirconia prosthesis comes back, it is a question of lack of attention or capability. However, if you provide such photos to the lab, unlike the past, I'm sure they'll be able to come up with aesthetic zirconia prosthesis. Second question. Out of different prosthesis types, why do you focus on zirconia prosthesis? If you can do ceramic and zirconia crown at the same time using digital technology within your dental clinic, that is the best. However, there's limitation in space and finance. And we need to choose. Which tool or equipment should you choose? You need to choose something with a bigger spectrum, which can be applied to more indications. In my opinion, more so than ceramic, zirconia prosthesis has a much wider scope and breadth. Therefore, in my case, I try to focus more on zirconia prosthesis. This is the end of my lecture. Next time, I'm going to talk about why guided implant placement is necessary. Thank you for watching.